So what I'll do is start with an overview of the National Workplace Initiative. It's actually a really amazing project in and of itself. So it's a really significant investment from government to create a nationally consistent approach to mentally healthy workplaces. So there's really a recognised need that there's so many different approaches, so many different resources, so many different players in this space. And one of the challenges for workplaces at the moment is how to navigate all of those things, how to connect those things together so they know they're doing the right things. So what we're aiming to do in this initiative is to create an evidence-based framework for mentally healthy workplaces, help people connect to the right things at the right time, showcase some of the successful approaches already underway, and really kind of strengthen and amplify initiatives rather than coming in and duplicating and adding more to the noise. This project's really around connecting up and getting some consistency. So it's being led by the National Mental Health Commission, but it's really strongly advised by the Mentally Healthy Workplace Alliance. So they're our national peaks in a range of business, industry, worker representative, mental health, occupational health as well, and really trying to work quite closely with all the states to make sure it's consistent with what they're doing as well. So there's definitely been such a healthy input from the SA team. It's just been amazing. I'm going to admit Marty to the waiting room because it looks like I've got control. So what I'll do is start with sharing some of the insights that shaped our approach, because it's really guided why we've designed things in the way we have. So starting this project, we really tried to stop and listen and understand where the needs were, so we weren't just adding more confusion and noise in with this project. So some of the key insights that really resonated quite clearly and consistently is that mental health is really becoming an increasing priority within workplaces, particularly during COVID. So there's an appetite, but there's also a reality that a lot of workplaces are facing around mental health. When they do reach out for support, and I'm sure that most people kind of experience this as well, you get really overwhelmed quite quickly navigating the existing resources. And that includes what's relevant for the problem I have, but also what can I trust? So there's a lot of white noise when you reach out for information. There's a focus on well-being or crisis support often, but there's a lot of opportunity we can harness by going further upstream and looking at kind of how work is designed, how managers are skilled up, a lot of the things that we can do within organisations to prevent and protect as well as respond. We also heard that there's really different needs that shape how people interact with resources. So some people are coming with an immediate problem, some are coming wanting a strategic approach. Something that's really been consistent is small business really needs different information and supports to medium to large organisations. They don't have extensive HR, work health safety resources that they can lean on. So there's different materials and different content that people need based on industry, location, role, organisation size, but also kind of where they are in their journey as well. And a lot of people said that they actually value learning from peers just as much, or if not more, from experts. So communities like this are actually really important because people are often interested in how to make things work. So how did you actually do that? How did you convince leaders? When you hit this snag, what did you do with that? And we also heard a one-size-fits-all approach is often too generic to be useful. So it really doesn't hit the mark for a lot of people. Or information is either too light touch or too dense and too technical. And so there is a little bit of a gap around really practical how-to information at the moment. Stepping back, which we get the luxury to do in a national project, there's this huge value in connecting up the system to bring some consistency. So that's what I love about the collaborative approach in South Australia. You've kind of got the people who are really active in this space working together rather than kind of running their own races and creating more confusion. There's also a significant opportunity we see in these emerging industry-led initiatives. So really kind of industries looking at what are the key issues and how do we get an economy of scale by approaching this at an industry level rather than having every workplace reinvent a wheel on their own. And we also saw that coverage is really lumpy. So there's 1,000,001 tip sheets on how to have a conversation or how to support people working from home, but there's some real gaps in other areas. measurement reporting or specific skills that managers need to have. So when we looked at all of these challenges and needs together, what we create in the process of creating is actually a collection of products and resources and activities. So not just one thing that we're creating, but actually a few different things that work in parallel. So the first is our blueprint, which are the guiding principles of mentally healthy workplaces. We're working on a digital platform, which is really aiming to be an aggregator and connector. Where there are really big gaps in the sector, we're working on some in-depth resources and thought leadership to address them. And we're also feeding back as much of that policy advice as we can to the sector so they can jump off from where we are rather than restarting from the beginning as well. So what I might do is talk you through some of these specific products and resources, and where they're already available, I've inserted a link, and when the slides go out, we can make it easy to find. So the first is our blueprint for mentally healthy workplaces. So this is our North Star document that defines what we're talking about when we talk about a mentally healthy workplace. And it was actually probably one of the most challenging things to develop in the sector, because everyone had a slightly different view on what a mentally healthy workplace was and how we get there. So this is really designed to be a living document, and we're now kind of sitting on release 2, which has integrated some of the feedback we got in this release that's live at the moment. Essentially what we're looking at is 3 pillars of a mentally healthy workplace. So the first is really consistent with the work health safety requirements, and it's around PROTECT, so identifying and managing work-related risks to mental health. So it's really looking at how work is done, how work is, the technology, the rostering, how's all of that impacting mental health in the workplace. The next pillar is respond, which is a bit more what we think of when we talk about mental health in the workplace. And it's about this capability to identify and respond to support people experiencing mental ill health or distress. And then the third pillar is a lot more aspirational, but it's about recognizing that work is actually really good for people's mental health, and how can we enhance those positive aspects like opportunities for growth and development and relationships and routine, and how can we amplify them to really build resilience and positive mental health. The next resource that I'd like to talk through is the one that we've done on industry-led initiatives. So what we can see in the sector is there's lots of industry-led initiatives emerging quite organically, and you've got some for kind of construction like Mates in Construction, transport and logistics like Healthy Heads and Trucks and Sheds. But there's also a lot of action happening in the arts and creative industries, AFL Players Association. There's really different initiatives, and they look quite different. So what we wanted to do is understand what are the ingredients of a really successful industry-led initiative, and through expert reviews, desktop research, and some case studies, we boiled down some key principles that are kind of consistent in everything people have done or learnt along the way. And so what we've done is turn them almost into a business plan on a page that talks through how industries can set up an industry-led initiative, but also how industry-led initiatives can refine what they're doing. And I think more and more, this is an opportunity where we as a sector can really fast track some of the gains that we're making. The next one kind of feels like a bit of a holy grail. So they're sitting with me in final draft form and most likely going to come out after the election. But this is looking at how workplaces can measure elements of mentally healthy workplaces. So we hear this is kind of a catch-22, that people can't articulate where they're up to or whether things are working. They're not sure how to use the measures that are already available. So we worked with a collection of experts led by UNSW Business School to look at what do we measure as part of that continual improvement approach? What do different measures tell you and what do they not tell you? How do you manage some of the issues around privacy and confidentiality? And what we've done is created them into 2 guides. So the first guide for small business and sole trader is really practical, hands-on. It's, what do you look for? How do you have that conversation? What do you need to think about when you're collecting this information in a really small team? How do you communicate that? What do you do with it? And then the other guide's really for those medium to large organisations, and it's looking around systems and processes and HR data that you might be able to use and leverage, as well as some of the tools that I know are out there and some of the people in the call have contributed to, like the People at Work tool as well. So where do those fit in within your approach? We've also worked with the Mentally Healthy Workplace Alliance and Head for Business to create some resources for a range of organisations, so medium to large, small business and sole trader again, around creating a mentally healthy workplace during COVID. So these were launched by the PM back in November 2020, but a lot of the principles are still really relevant today. Things around communication, change, managing anxiety, spotting signs of distress. And in the last few weeks, we've released some new guides, which are really focusing on some of those emerging issues. So how do we actually return people to workplaces? How do we look after the mental health of our decision makers who've really been captaining ships through tumultuous times for years now? How do we deal with things like fatigue and burnout, and what's the difference? But also stepping into some really interesting spaces with the health of experts, including the Australian Faculty of Occupational and Environmental Medicine, to look at things like post-COVID syndromes, or managing things like vaccine hesitancy, or really different emotional reactions to COVID in the workplace. So we're hearing that there's kind of a lot of stuff coming up in workplaces around people catching COVID or not catching COVID, including things like a sense of shame that people have caught COVID. Or a sense of judgment within teams that people might not have had the best hygiene practices if they've caught COVID. So really stepping through what some of them are and how you can manage them in a team. Looking at mentally healthy hybrid teams. And another one, which is, I think, really important to acknowledge, is the hidden impact of sleep. So working with a team in Appleton, down in Adelaide, around how has COVID actually impacted on people's sleep, and why is that really important when we're thinking about mental health in the workplace? So things like parents maybe pushing hours really late to make up for homeschooling, or sleep disruptions because you're working in the same place that you're sleeping and that really throws your rhythms out, or kind of losing a sense of routine, so your sleep hours go out as well. So really practical tips for what to look for and then how to get some of that stuff back on track. Now, what I'm going to do now is walk you through a couple of screens of the platform, the digital platform that we're building at the moment. So a lot of the stuff in here is really placeholder text and images as well. But what I want to show you is the concept of what we're building, because it's quite different to what we have available at the moment. So what we want to do with this digital platform is kind of aggregate trusted resources. So people can search by a topic, find out everything that we brought in all over Australia based on that topic, and then they can sort it within our platform. So based on your organisation size, the type of work or industry that you're in, your role as well, your location, and if you're looking for particular things like a webinar or a guideline or a case study, letting you sort by that as well. So really trying to bring everything to you rather than have you kind of explore around the internet trying to find these things. Here's a good example of what that will look like. So if you typed in something like mental health toolkit, you get a list. If you click on one of these external resources, it will tell you everything you need to know about that resource, who's created it. What it will let you do is save it within our platform, so you can find it again, because that's something we heard that people found challenging before, is just, I found this great resource, but I can never find my way back to it again. So helping people just kind of keep track of what was helpful in our environment, and then passing out to that external site. So still kind of letting providers update things, keep that fresh, keep traffic coming to their sites, but having our website as a centralising location. And then also using a lot of our information architecture to recommend similar things. So if this is something you're interested in, you might also want to look at this resource or this resource or this resource. So helping people explore around a topic that we know that they're interested in. Another thing that we can do in this platform for logged in users is see those saved resources and help them sort. So it might be that they're developing a bank of resources within their organisation around a particular awareness day. So it might be Safety Month, and so they really want to collect a whole range of resources relevant for Safety Month. They can save it, but they can also share that collection with others. So it can be through a public URL or a password protected URL. So it's a bit like Pinterest, and you can kind of create little collections in our platform and share them with others as well. So for small businesses, this can act almost like an intranet for them, where they can bring resources that they're interested in together and update that over time. Another feature that's testing really well for us is this aggregation by industry. So what we've heard is a lot of the resources around office workers just aren't relevant for someone in construction or professional AFL sports. So it's actually being able to point people to existing resources that are really relevant for the kind of work that they do or the kind of industry that they're in. So this is how we're trying to amplify the really interesting stuff coming out around industry. So great examples are podcasts for people who are truck drivers. They can listen to them while they're on the road, but they'll probably not be sitting down at a computer reading fact sheets. So how do we connect people to the industry specific resources and information? And for the people who really want to run at this almost like a professional development approach, what we're setting up is some structured learning pathways. So directing people through content in a really flexible way, but showing them the recommended order that we think that they should read it if they're kind of starting from scratch. So starting with the basics of, what is a mentally healthy workplace? How do you show the value? Who do you need to have on board in the workplace? If you're setting up a working group, who should be on there? And how do you, get that burning platform for change going, all the way through to some of those topics around leadership. So how do you expand approaches through supply chains? How do you create this really assertive participation of people with lived experience in the workplace? Some of the things that you might need to consider about risk in some of those approaches. So really kind of having a learning pathway that you can track what you've read, read modules in any order you want to, but see where it fits in within a broader approach. Some of the things happening in the background in addition to the digital platform are some more of those deep dive resources. So we're working with a range of universities like Swinburne or organisations like Transitioning Well or Everymine to create some resources around hybrid work, supporting people through career transitions, information specifically for small business. So just kind of getting to the heart of what's relevant for small business owners to know, guides for managers around some of those tricky issues like performance managing people, experiencing mental ill health and what's reasonable management action, how do you manage some of the conflict of returning to work, a guide or a framework for procuring mental health services, so including EAP, but also looking at training, mental health first aid training programs. What should you be looking for from a supplier? What kind of evidence should they be able to show you about the effectiveness of their service? Trying to bring together some of those resources around return to work and stay at work across really different schemes, guides for supporting diverse communities, guides for workers, supporting people in disasters, and also looking at those decision makers as well. So a really quick kind of overview of what we want to achieve out of the NWI with all these different resources and products. What we want to do is get a system-wide improvement in a couple of areas that we think is actually going to lead to those long-term changes that we want. So we want better alignment. So if everyone's talking about similar things, it's much easier for people to understand how they connect all together. We really want to build knowledge and capability. So what are the skills that people need to have in order to respond or design work in really effective ways? We want to see a change in action and investment. So not necessarily more of anything, but really smart direction. So can we actually get more efficient in the programs that we're investing in or what we're asking to see as outcomes? strengthening champion network. So this is a champion network right here. So how do we actually get people really sharing what's working and being connected into others, and changing attitudes and structures as well. So particularly for stigma. So I'll send my contact details around, and that also includes where to find the resources that I shared. We're definitely looking for people to reach out, get in touch, because we'd love for people to test resources in the platform, particularly before it's released to the public. It's a very iterative project, so we have definitely had many drafts of all of the things that I'm showing you today. And that's how we want to run the project, really kind of have people tell us what's useful, scale back the things that just aren't relevant or aren't working. So I'd love to have everyone engaged in that. So I might stop sharing and hand back to you.